is a common problem encountered in the outpatient and emergency settings. It is important to differentiate between headache and migraine. The term headache disorders covers a variety of neurological conditions that can cause pain in the head. It is important to differentiate the different types of headache, be it primary or secondary. Migraine is classified as a primary headache disorder that can cause intense throbbing headache lasting few hours to several days, whereas the secondary headaches covers the medical conditions of the central nervous system that can cause headache. I am not Sherlock Holmes, but I hope I can share with you some tips to solve this conundrum. First, you have to understand the pathophysiology. What are the primary and secondary headache disorders? And lastly, but most importantly, to recognize the red flags of headache. Tip number 1, the pathophysiology. Why do we get headaches? Is it when we come back from home to this clutter? If you are faced in this severe traffic jam, or you are working late to beat deadlines. Even Harry Potter is not spared from headache. To understand the pathophysiology of migraine, first we look at the neurovascular model. This involves activation and sensitization of pathways within the trigeminal vascular system. To look at this more closely, the vascular model refers to vasodilatation of the meningeal blood vessel that activates the trigeminal sensory nerves which surround the blood vessels, and this leads to the experience of pain. This also causes certain neuropeptides in the brain to be elevated, such as the calcitonin gene-related peptide. The CGRP levels are raised during a migraine attack, and this causes the pain. Whereas the neuronal model refers to the changes in neuronal excitability and sensitivity which result in activation of the trigeminal system. Tip number 2. What are the primary and secondary headaches? This table shows the etiology of headaches, the primary headache, namely the tension, migraine, and cluster headaches. Whereas the secondary headaches, it's a very long list encompassing from vascular causes, infections, drugs and toxins, tumor, ophthalmologic conditions, endocrine and metabolic conditions. I'd like to share with you the International Classification Headache Disorders. Under this classification, it is broadly divided into the primary headache disorders, which you have the migraine, tension, headaches, the trigeminal, autonomic, cephalalgias, and others. The secondary headache disorders, which we'll look into after this, and neuropathies and the facial pains. Under the primary headache disorder, migraine is the most common, followed by tension type headache. Migraine attack has 4 phases to it. Prior to the attack, it starts with a prodrome, where the patient may have food cravings, neck stiffness, and fatigue. This lasts from few hours to a day. Next comes the aura period, where 20% of the cases may complain of changes in the vision, where they see some spots of light, flashes of light, zigzag lines, tingling sensation in the skin, language problems, and this may last from 5 to 60 minutes. The headache itself is usually unilateral, lasting 4 to 72 hours. And this tends to be throbbing and pulsating in quality, aggravated by routine physical activity. It can be associated with cutaneous allodynia. The patient may experience other symptoms like hypersensitivity to light. They cannot look at bright lights. They cannot stand loud noises, or even certain smells put them off, and they may have nausea and vomiting. After the headache is over, that's not the end of story. You have the post-drome period, where you lose concentration, feel fatigue, you may be irritable, you may crave for certain food, and this may last from hours to few days. So the tip number 3 is to recognize the red flags of headache. Some of the red flag symptoms, such as a first severe headache in patient aged over 50 years, you often wonder, is it the primary or secondary headache? The primary headache refers to migraine or tension type headache. If you have symptoms of headache which is sudden in onset, that reaches maximum intensity within 5 minutes and associated with any Valsalva maneuver such as coughing, straining, exercising, it may be due to primary headache like exertional headache, cough headache, but the secondary more sinister headaches are things like subarachnoid hemorrhage or pituitary apoplexy. The third symptom, if you have a accelerating pattern of headache, must look for any recent head injury in the last 3 months. If you have persistent fever with headache, look for any immunocompromised problems such as HIV, or patients using any immunosuppressive drugs. Any focal signs and symptoms also is a red flag symptom. This may be associated with cognitive dysfunction, personality changes, and any history of malignancy. If you have papilledema on examination, then you're worried about things like a space-occupying lesion, or you have a red eye with a headache, because you're worried of ophthalmological conditions such as glaucoma. So if you cannot remember any of those, then I'll summarize into the 6 red flags of headache, which are: first, facial pain or injuries. The second, if we have focal signs such as hemiparesis, facial asymmetry, speech disorders. If you have the first onset of headache at an older age, if you have persistent fever with persistent headache, you have to look for signs of infection. You have fits and headache, of course, infection is also top of the list. And if there's a change in the frequency or change in the pattern of the headache, you have to look for a secondary cause. The facial pain may be attributed to trauma or injury to the head and neck region, especially things like whiplash injuries, cervical spondylosis, postcraniotomy, and if somebody bashes you up in the face. Headache or facial pain due to the problem in the eyes, ear, nose, the teeth, the mouth, or any facial or cervical structure. Orbital cellulitis, chronic otitis media, or chronic sinusitis. If you have focal signs such as weakness, such as any facial asymmetry, you have to look for underlying vascular events such as huge stroke with midline shift, a hypertensive emergency with the intracranial hemorrhage, ruptured vascular malformation, arthritis, venous sinus thrombosis are few of the causes. If you have the first onset of headache at the older age, of course, you have to exclude an intracranial lesion. Headache attributed to non-vascular intracranial disorders such as increased or low CSF pressure, non-infectious inflammatory intracranial disease such as giant cell arthritis, intracranial neoplasm, epileptic seizures are some of the causes. The next group of headache attributed to substance or its withdrawal, such as exposure to a substance or substance withdrawal, can also lead to headache. The chronic migraineurs who overuse their analgesics may experience this condition called medication overuse headache. Fever and fits come hand in hand, and you must look for any intracranial infection. TB or cryptococcal meningitis can cause this sort of severe infection in the brain. Headache attributed to systemic infection also leads to headache. If you have increase in the frequency, change in the pattern of headache, you have to look for any underlying cause of homeostasis such as hyperviscosity, electrolyte imbalance, hypoxia or hypercapnia, dialysis headache, headache attributed to fasting or cardiac cause. So in conclusion, in this short video, I hope that you have understood the pathophysiology of migraine. We look at certain primary and secondary causes of headache, and it is important to understand and recognize the red flags of headache. So I hope that this short video has helped to solve the conundrum of headache and migraine, and I thank you for your attention.